morning. I'm Kim McCleary, President and CEO of the Los Angeles World Affairs Council and Town Hall. During these challenging times, we have pivoted to live stream programming so that we can continue to offer you national and international speakers on the most compelling and timely issues. But we can't do this without your help. Please consider becoming a member of the Council or making a contribution by going to our website at lawac.org. It is my great pleasure to introduce today's program on innovation and preparation for an uncertain future with the Consul General of Israel, Dr. Hillel Newman. This is a partnered event with the Los Angeles World Trade Center, and Stephen Cheung, President and CEO of the LA Trade Center, will be moderating today's discussion. Dr. Newman and Stephen, thank you both so much for joining us. Stephen, I turn it over to you. Thank you.
Thank you so much, Kim. Good morning, everybody. Pleasure to be here today, and it's a fantastic conversation we're going to be having with Dr. Newman. There's a lot of questions I want to get through, so we're going to get right into it. And as the audience know, in California and Los Angeles, we're dealing with a slight increase in terms of the coronavirus cases. So we're looking to the world to really learn from them the best practices and how they're able to handle some of the issues that are arising very quickly. And from these experiences, we hope to be able to reduce the case spread as well as the death rates. And we're very fortunate in Los Angeles to have the world's third largest consular corps. After New York and after Hong Kong, we have over 100 different countries represented right here through our consular corps system. And one of the most active and most impressive consulates, of course, are Israeli Consulate. And our Consul General, who's been with us since last year, has always been a great supporter of the international community. But I'm sure his experience here coming to Los Angeles since July has changed significantly in this year. So with that, I would love to ask Dr. Newman to share a little bit in terms of what's happening in Israel and what you're seeing on the ground and what we can learn from each other. Dr. Newman?
Hi, good afternoon, everybody. Stephen, thank you very much. Deep gratitude for being my moderator and host. I'd like to also open with deep appreciation to the World Affairs Council, the Los Angeles World Affairs Council, to the World Trade Center of Los Angeles, the Town Hall as well. I attribute great importance to these organizations, distinguished organizations that give such wonderful service to the community. Great fan and supporter of the organizations, and so it's really my pleasure to be hosted by you. Also, special thanks to Claire and Jessica, and of course Kim, for introducing everything and helping and making this happen. Okay, I'll just open with a bird's eye view of issues that perhaps we can, of course, dwell on them later. But I'll open with, let's start off with the exact situation in Israel. The data is that we have at the moment, up to now, 260 fatalities, deaths. 260 is really, I mean, every soul is a terrible tragedy, but that's actually 1/10 of the US mortality rate. And the second thing is the amount of sick people. We have now 4,186 active sick people. Out of the total, we had 16,000, more than 16,000 people who were stricken by the coronavirus. As of now, we have 55 people who are being ventilated. And we have the bigger issue, of course, or the issue at the same time is the unemployed. The unemployment in Israel has risen from 4% in February to 26%. So the economic issue is central and on the agenda. In general, we've flattened the curve, and we've reached a situation that those that are recovering are greater in number and quantity than those who are sick. So we have actually flattened the curve, and that enabled us to be one of the first countries to implement a pilot exit strategy. Israel has implemented a pilot exit strategy. We were actually, I think, the second in the world after Austria to begin. We were also one of the first to implement the restrictions, to impose restrictions on movement at the beginning. It was already in February, but we were one of the first to go out and implement the exit strategy. we can talk about that if people have questions, what exactly the exit strategy is in Israel. I'll just say a few items which are, I think, unique to Israel. The first thing is that a new government was set up in Israel, what's called a National Emergency National Unity Government. I think we are the only country in the world that the impact of Corona has been coming together and a forming of a national unity government. It's like the Republicans and Democrats coming together to make a government in order to meet the challenges. So that happened in Israel, and the government is supposed to be set up tomorrow in our Knesset. Second thing I'd mention, which is quite unique, is that Secretary of State Pompeo is right now in Israel as we speak. He began an official visit this morning, Israel time, and that just, I think, demonstrates the intensity and the intimacy of the relationship between Israel and the United States. We have many issues on the agenda, and even we're in a pandemic. Even so, we can find the ability to meet, and this is his first official visit abroad since the outbreak. Another thing I would say is unique to Israel was the high-tech approach. From the beginning of the pandemic, a high-tech approach was adopted. Incubators were set up, multidisciplinary teams were set up, and you have private and government organizations coming together. You had a mix of technicians together with computer engineers, together with doctors and medical personnel working together on solutions. And I think it was very early in Israel, and it also made a big change. Another aspect I mentioned, which is unique about Israel, was it was taken as a national security issue. And a main control center was set up, which brought in all the different apparatuses of the government, including the security forces, including the medical teams, including diplomats, the Ministry of Foreign Affairs, the State Department of Israel. They all came together in order to, again, find solutions for the problems that were on the table. The problems were identified and then solved one by one. The last aspect, which I'll say is quite unique about Israel, was the military involvement in civic issues. The military was recruited in order to solve some of the civic issues. And for instance, they gave out food. And there was an interesting meeting of IDF soldiers with ultra-Orthodox citizens in Bnei Brak, a city in Israel, where you have these type of populations that never meet. And here, all of a sudden, they met in very special circumstances. Lastly, I'll just say, before I return the platform, I'll just say that, there were a lot of apocalyptic scenarios. Of course, that's not true. We're not in an apocalyptic doomsday scenario. There was a lot of talk about the collapse of the geopolitical world order. That's going too far. It's a bit exaggerated. But looking towards the future, there are definitely going to be dramatic shifts in the economic world order and perhaps also in political world order. And in the long term, we can expect an extended impact of the coronavirus. We will see gaps widen between the developed and the underdeveloped countries, even within countries between those that are more wealthy and less wealthy. We will see a swerve from globalization towards local supply chains and local production and national economies and things like that. And the king of the future will be artificial intelligence, no doubt.
Thank you, Dr. Newman. You mentioned a couple key points that later on would love to address, but one, to hear that Israel right now has 262 deaths compared to, for example, Los Angeles County alone. As of today, we have about 1,613 deaths and over 33,000 cases. It's definitely very disheartening here in Los Angeles to see the number continue to rise. And as of yesterday, the LA County officials have already discussed extending the Safer at Home initiative for another 3 months. So this is going to have a huge impact on the local economy. And to your point that you mentioned earlier, going from 4% to 26% unemployment in Israel, LAEDC, the parent company of World Trade Center Los Angeles, did a white paper just earlier this month and estimated that our employment rate in May can reach as high as 30%. So this is definitely something that we share with the global community in terms of the balance between health and also the economy. With that said, a lot of our folks here, whether it's local municipality, we're depending on our government system to work and to function properly. And what you mentioned is actually would love to delve a bit deeper to get more information. We would like to see our elected officials, especially in Washington, D.C., to work more collaboratively to solve some of these issues. You're mentioning the forming of this new government in Israel. Can you give a bit more context in terms of how that's happening, how that partnership is doing, and what the expected outcome would be with a unity government?
Sure. Sure. Well, it is an amazing impact, I think, of the coronavirus that this government has come together. As I said, it's like Democrats and Republicans coming together and forming a government. It's called the Emergency Unity Government, and it is supposed to be set up tomorrow in the Parliament. So it is quite dramatic. I would just make one reservation. You know, Israel is a very strong democracy, which is quite rare in the Middle East sometimes. But our democracy is such that the Supreme Court has the final say on different positions towards the court about the setting up of the national unity government. So the final word will be in the hands of the Supreme Court. So we're waiting. At the moment, the government is going to be set up tomorrow, hopefully, and then the Supreme Court will have its say. The Supreme Court, if it approves and everything's fine, then we have a national unity government composed of more than 72 members of parliament out of 120, to be one of the largest parliaments ever in the history of Israel. I'll just say perhaps a few interesting insights about it is one, this was a result of significant compromise. The two big parties that came together, one is the Likud party under Netanyahu, and the other party, which is called Blue and White, under Gantz. Gantz ran a very severe campaign against Netanyahu, and he gave a pledge during his campaign that he would not sit with Netanyahu. And following the elections, due to the setting up of an emergency national unity government, Gantz had to go back on his pledge, which is a big compromise. The compromise on Netanyahu's side was that for the first time, he's going to limit his term as prime minister, and they're going to do a rotation. So Netanyahu, who's the longest serving prime minister in the history of Israel, 13 years now, he's got a cap. And the cap is 18 months. And after the 18 months, Gantz will take over as prime minister. So both sides had to make significant compromises in order to form this government. And I think that's advice, a recommendation for everybody. In periods like this, we need compromises. Otherwise, you can't move forward. Now, the biggest challenges facing this unity government, of course, the health and the economy. In Israel, it's not seen as one is political and the other is urgent. We see both of them as urgent, both of them. You know, there's a saying in Hebrew which says, you need a healthy soul in a healthy body. So you need both. You need a healthy soul and a healthy body in order to move forward in life. So we see both of them as urgency situations which need to be addressed. And we hope for stability.
Got it. You also mentioned before about an approach of using high tech. For the audience, there is a document that's attached to this webinar, and it shows that if you open it, you'll see that there are over 70 Israeli companies that are using tech to combat and address coronavirus issues. Would love to learn more about basically what kind of technologies are being developed right now, and also because we have a lot of audience members that want to ask questions, I want to give them some time to answer it. So I'm going to mix in a couple questions together as well. Knowing that California and Israel previously have signed an MOU agreement already, talking about collaboration, especially with technology. Can you talk a little bit about not only the tech that's being developed out of Israel to address this global pandemic, but also some of the partnership that's happening with California and with the US, especially with Secretary Pompeo there? What kind of partnerships are available and happening right now between Israel and the United States, and especially California, to address some of these issues?
Sure. I'll try to do that briefly. First of all, the challenges which face us due to the pandemic and due to the period of time is also a period of opportunity. And I think that Israel is best situated in order to move very quickly from difficult situations in finding solutions. I think that's part of the experience of Israel, and the unique aspect of Israel, that we're the only ones, I think, in the world who were sitting in shelters with gas masks during the Gulf War. We're the only country in the world that has rockets sent on the country from the south, from Gaza. So people in Israel are used to the fact that you can move very quickly from a regular normative situation to an emergency situation. And I think that helps also in the high-tech community in addressing the issues very quickly. And another general remark I would say is that the pandemic is definitely going to accelerate trends which existed even before. The trend of moving towards artificial intelligence is a trend which existed before, but it's going to be accelerated dramatically due to the pandemic. If you look just at the top companies 10 years ago, the top 10 companies, you'll see that most of them were energy companies. If you look at the top 10 companies today, they're mostly software, high-tech innovation. So the world is changing. You asked about innovation coming out from Israel in the pandemic context. Let me just give a few examples. I won't go into all the details, of course, but just a few examples from different fields. For instance, remote telemedicine. That's a very significant field, and Israel has come out with robots that can give service to patients, even giving food, giving communication service, taking vital signs, all kinds of things in order to minimize the contact between the medical staff and the patients themselves. Also, communication services in order for the patients to speak with their families. It's robots which walk around and serve the patients. There's a very interesting company, Temi, to look at. PPEs Israel set up many companies that produced 3D PPEs, like face shields and all kinds of things. So that's another big aspect of self-production of PPEs, which has been taken very seriously in Israel. Third aspect is contact tracing. There's a few companies in Israel dealing with that. One of the central ones is Magen, which initiated an application that everyone can download on their cellular phone, and that enables the tracing of your movements over the few days, so that you can always backtrack and see if you had a cross junction with someone who is then afterwards diagnosed as sick. Ventilators. Let me give you an example of the ventilators. Paramedics in the military took the idea of a manual balloon that you usually use to ventilate someone in a battlefield, and they changed it swiftly into the use of ventilators in hospitals. So the result was that you have cost-effective, very cheap ventilators for $500,000, which served more or less the same purpose as the large medical ventilators, which cost $30,000, $40,000. Let me give one or two more examples. Diagnostics. It's a big field in Israel. Many high-techs are involved in it. Just give one example is, for instance, Surgical Theater, which is a company which is here in Los Angeles. There's a branch here in Los Angeles, and they do 3D dimensions of the human body, and you can see the coronavirus. You can color the coronavirus and see how far it has reached in the lung. It's a very special and new application. A remote delivery. That's another field which is very central in remote delivery. We have drones which can deliver produce, food, whatever, and it's already in use in North Dakota and other places in the United States. So I'm just giving a broad view of the aspects. As to Israel-California cooperation, I'm glad to say that there is quite extensive cooperation. We have water technology, very extensive cooperation, green tech. There are quite a few fields, cyber security. But that's besides, of course, the regular trade. Our trade is reached close to $2 million each side. So we're talking about quite a significant amount of trade. I'll just say that we had an MOU in 2014, which was signed by Governor Jerry Brown. And then we had an MOU on innovation, which was signed already in 2017. I can mention a few very significant deals that have gone through between Israel and California. If I just mention one of the most recent is the acquisition of MoveIt by Intel. And MoveIt is an Israeli application, and it was bought for $900 million just in April this year, just a month ago. So the business is continuing in all fields, I would say. I'd also just like to mention that there are quite a few bodies here that do wonderful work in promoting this cooperation. I'd just like to mention, like, for instance, the Milken Innovation Center, the Mirage Foundation, Vardi, who's a businessman who brings together incubators and young high-tech people. So there's a lot going on, I would say, especially in the water technology. We know there's a shortage of water in California, and therefore we've taken this seriously, and we've set up a desalination plant, an Israeli company, and we also monitor the desalination plant in Santa Barbara. There's a lot going on in water technology.
Perfect. I'm going to ask one last question before turning it to the audience. You mentioned a lot in terms of the future, artificial intelligence being accelerated, and also with the global economy changing very quickly, in terms of trade continuing. In Los Angeles, we're very dependent on international trade as a major economic driver here, with the Port of Los Angeles and Port of Long Beach seeing a drop of around 15% in just the first quarter, and also LAX, the world's fourth busiest airport, have seen a 90% plus reduction in their traffic. This is going to impact our world in the future. So from your perspective, with all the advances in technology, and also now people are required to have additional safety requirements before they can go back to work, what is your projection for the global economic? I know it's going to be a very difficult way to project the future, but in your mind, what do you see the future is going to look like from an Israeli standpoint and also for the rest of the world?
Yeah, if I look into the future, I would say that it's definitely artificial intelligence. As I said before, I don't think that we should take these apocalyptic scenarios and these exaggerated statements seriously. But we should definitely take into consideration that there will be shifts in the world order of economy and politics. And there will be short-term results, impacts, and there will also be long-term. If you look at the short-term, then I would say, okay, there will be an upbeat in consumer demand, especially when as people get more free and they have freedom to move around and shop and whatever, we'll see an upbeat in consumer demand. But the long-term effects are more important to note, and that's also this is a comment also for those who are, let's say, unemployed or looking towards the future. Where should they go? So I'd like to give a few pieces of advice. First of all, you should understand that globalization is on the down right now, and there's more of a turn towards the primacy of what we call state sovereignty or national state economies, or self-reliance, and this food and energy security. And there's a lot of competition. So with all the multinational, multilateral cooperation, there's also competition. So each country will also need to take care of its own needs and affairs. This will have a few results, which I'll mention. Another aspect which I think is projecting to the future is there will be a shift from global supply chains to local supply chains. If you look at, for instance, the retail sector, especially those have been hit hard, or especially the low wage and the low skill in-person services. They should take into consideration that things are going to shift. They're going to shift towards online services, digitalization, automation. So some of these people might find themselves out of work in that line of work. So they should start thinking about their future. Gaps will widen between those that are, let's say, more wealthy or more, especially if you look at national economies, those that are stronger and more wealthy will come out of this, I wouldn't say stronger, but they'll come out of this, they'll survive much better than those that are not so strong. We might even see the fall of regimes. So things are, now, if you look into the projection into the future, I would say the following fields should be noted as the central fields for the near future. Artificial intelligence, especially in the field of any field of high tech and innovation and applied sciences of these aspects. Remote technologies, all the different types. Tele everything, as one would say. Yeah. Digitalization, moving things from online, from in-person services to automation and digitalization. Streaming services. We've seen Netflix and other companies on a rise due to the coronavirus. All streaming services like Zoom and like others have risen immensely, and that we will most probably see that continue. Biotech is an aspect of the future. Robotics, and the whole field of non-touching, touchless. And that's a big field which is very developed in Israel and going through developing right now. But those are the fields. I would say local production supplies and local production delivery systems. That's a big thing for the future. Food and energy security, mainly self-reliance. I think cyber is a big thing in the context of online services and digitalization. Cyber security, cyber maintenance. These are the fields, I think, that people who are unemployed or people who are looking towards the future, where they should look.
Thank you, Dr. Newman. I want to at this point turn it back to Jessica from the World Affairs Council, who's been screening some of the questions that are coming in. I know there are a lot of them, so hopefully we can get to a couple of them. Jessica, would you like to join us and give us some questions that the audience has been sending in?
Sure, thank you. So yes, we are getting quite a few questions, so I'll try to get to as many as I can. The first question is, sorry, it moved, there's so many coming in. How long does it take to bring medical equipment and pharmaceutical products to market in Israel? Can it be done in months and not years? Are regulations easier than in the US?
Thank you for the question. My only condition about the questions is that they must be questions that I can answer, not questions that I cannot answer. Okay, medical. Let me just say that, look, our guidelines on medical devices and medication are not more stringent than the American or the European, like the FDA and the other services that authorize medication. In fact, most of the medication that is even produced in Israel or even manufactured in Israel, it is first sent off to get the approvals of FDA and the central organizations that run these things and give the authority, give the jurisdiction, the global jurisdiction. So I would say that if anyone wants to bring a drug into Israel, he or she should first get the FDA approval, get the global approvals. Once that is done, it's very easy to bring the drug into Israel. It's just a matter of logistics and getting approval and clearance. I can't give you exact time because things are changing now with Corona and people out of work and whatever, but the process is not extended as long as it has already FDA approval or approval of what's a recognized global conglomerates in this aspect. If it does not have any approval and is just seeking the approval of Israel, then that's a limited approval. I mean, we're not a world authority on this issue of medication. We have a lot of qualities. We're not ruling every quality in the world, and medication is not we're not the number one on that. So we can our recommendation is that they first get the FDA approval of the global big consumer aspects, and then come to Israel. And then the process will be very easy.
Thank you so much. Can you tell us about the COVID-19 vaccine being developed in Israel? When will it be available? And is the company able to produce quantities to help supply other countries?
Thank you. That's a very important question. And yes, vaccines is a big thing, big item on all of our agenda, because we know that there will not be a full return to normative society without a vaccine. It doesn't matter what we say and how much we put in effort, all the time that the coronavirus is abundant and we do not have a vaccine, we will always have this threat hanging over our shoulders. So the only real solution is vaccine or antibodies. Now, there's a difference also between antibodies and vaccine, of course. Antibodies fights the coronavirus even after you're infected, and the vaccine is in order to inoculate you before, in advance. In both fields, Israel has seen quite a few breakthroughs. Let's start off with, we've reached testing stages on animals in both vaccines and antidotes. We've also patented a few already. So our belief is that we have the vaccine and we have the antibody. So the chemical side or the research side is over. The process now is to go through the procedure. As we just relating to the previous question about medication, we turn to the FDA and we turn to the global bodies on this issue, and we've requested not only patenting but also clearance and approval. So let me just mention, for instance, antibodies have been developed in the Institute for Biological Research in Israel. It's a central biological institute in Israel. They believe that they have developed the antibody. It's based on plasma, blood samples of those who were sick. They took tens of thousands of samples and worked on it in order to produce the antibody. We've passed the R&D stage, and it's gone to the stage of experimentation on animals. The second thing is vaccine. We have 3 institutions in Israel that believe that they have developed the vaccine. As I said, we've passed the stage of the R&D. If you want to look it up, then for instance, there's one vaccine is called MigVax. It was produced by Migal. Migal is a company in the north of Israel, in the Galilee area of Israel. It's a very small company, and no one believed that such a small company would come out with a vaccine, but they were one of the first in the world market to come out with a vaccine. The secret is that they had already developed a vaccine for poultry before the coronavirus came out. They knew that there was corona in poultry, so they developed a vaccine for poultry. And when it hit human beings, then it was very easy for them to understand the sequence, to understand the RNA and the DNA, and therefore they immediately worked on the vaccine. They believe that they have the vaccine, and it's moved over to experimentation on animals. The next stage will be experimentation on human beings. There's also cooperation with California on this, which I'd like to mention. There's the Weizmann Institute in Israel, which is a research institute, very distinguished institute. They have partnered with a company here in the California area called Post-Era, and they're working together scientifically on the production of a drug that will help. I would mention also that there's a Professor Gershoni from Tel Aviv University who also believes he has the vaccine. He has patented it in the US Patent and Trademark Association, and it's built on a reception binding. In other words, it's a vaccine that is blocking the binding of coronavirus to the cells, and thus it doesn't have any impact and it falls away. So there are quite a few vaccines that are already on the market. How long it will take, it depends on the procedure. If the FDA goes more lenient, then it will take less time. If they stand to all the stringent procedures, then the procedure itself, just the procedure after you've already developed the vaccine, takes quite a few months up to a year. So that's more or less the timeline. It will depend on the FDA requirements.
Thank you so much. That's really interesting about the poultry studies. Before the pandemic hit, Israel was planning to engage in talks with the Palestinians towards the creation of a demilitarized state. Given this crisis, what is the status of those discussions? Do you think they will still proceed in July? And with a request to convene an international council as part of these discussions, but so many leaders having to focus more domestically, do you think the proposed peace plan and annexation could still proceed?
Yes. Well, as I said, Secretary of State Pompeo is currently in Israel on his first abroad foreign visit since the outbreak of the pandemic. And again, that's a testimony of the close relationship and the issues that are at hand. And one of the issues, it's not the only issue, but one of the issues is also the peace process. Let me just say one thing, that the peace process has been going on for a long time. But if you look at the beginning and establishment of the State of Israel, when Israel was established in 1948, and we just celebrated our 72nd anniversary day last week, When it was established, then the Arab and Muslim world responded with what was called the three no's, the three negatives, which was no recognition of Israel, no talks with Israel, no relations with Israel. There's a decision taken by the entire Arab League together with the Muslim states in Khartoum, and that remained very strong. But if we look now, 72 years later, Israel has full peace agreements with Egypt, full peace agreements with Jordan. Israel has understandings with the Palestinians through the Oslo process, and since the Oslo process, the Palestinian Authority has been set up as an independent institution. People don't know that the Palestinians have Palestinian passports. Those that the Arab population in what's called the disputed territories, or the West Bank and Gaza, they can have their own Palestinian passports. So it's set up an entity, and even with Arab and Muslim states in, let's say, the Persian Gulf states, the outer world of the Arab world, Israel has very deep understandings. So we have moved forward. Regarding the actual peace process, we've been through a few stages. The realization right now is that we need a bit more realistic thinking in the peace process. Up to now, the international community gave just about automatic support to any Palestinian position that was put on the table. And that actually was an obstacle to peace, because it raised their expectations high sky. And they weren't prepared to compromise on everything. The final analysis is that the dispute today is not really about territory. It's not about water. Israel has solved the water problems and territory. There are quite a few plans that were put on the table, which the Palestinians could have accepted, and we could have had peace a long time ago. 3 options were set on the table, offered to the Palestinians for full peace, and they were rejected. So the real issue is, are they prepared to accept Israel in the Middle East? Are they prepared to accept the long-term existence of a Jewish state, majority Jewish state in the Middle East? That's the big issue. It's not Israel's acceptance of the Palestinians, it's actually the opposite. That's the key issue. And the peace process, which is now promoted by the United States and Israel, was adopted both by Netanyahu and Gantz. The peace process, which is now also promoted by Pompeo on his visit, brings a bit more realism, because it starts setting the guidelines and the context of a real agreement, which also the Palestinians must make their compromises. Whether it will happen in July, I wouldn't give a date. First of all, it requires the Palestinians return to the negotiating table. The Palestinians are those who are refusing to come to the negotiating table, which is quite absurd. I mean, they say that Israel is the stronger one, and they want territory and they want other things from Israel. And Israel is sitting and waiting for them to come to the negotiation table, and they refuse. So the first stage is we must return to direct negotiations and talks. Israel is ready at any moment to resume the talks. And I believe that if they come back as a true negotiator and a true party, we will reach peace. Whether it will happen in July, I'm doubtful.
Great, thank you. Are your borders closed for visitors from other countries?
Yes, Tilly, the regulations about visiting Israel change on a daily basis. So it would be quite irresponsible of me to say what exactly is happening. For quite a period, the borders were closed for non-Israeli citizens. So, and that what was a big issue for us here in the consulate, in all kinds of cases of people who wanted to visit for extenuating reasons and emergency cases, and we had to deal with it. And the problem was that the borders were really closed for non-Israeli citizens in an attempt to not spread the virus too much. Slowly, the regulations are changing. It's not totally open. Those who want to visit can request, and then we can request for them. And we have to get clearance for a non-Israeli citizen to visit Israel. We need to get clearance for them to visit. They must turn to us by email or telephone. They don't need to come to the consulate. They can send an email, and we'll take care of the request and make sure that it's submitted to Israel. And the regulations change all the time. They're going more lenient all the time. So if anyone is interested in visiting Israel, they should turn to us, and we will give them the directive of how to move forward.
Thank you. What is Israel's commitment to international health organizations and the need to provide assistance to countries without the infrastructure enjoyed by Israel?
International assistance and cooperation is a high priority, top agenda issue in Israel. Well, since the breakout of the pandemic, also Israel has initiated cooperations between research institutes in Israel and between research institutes around the world, United States, of course, but also other places. Italy, even places that were hard hit by the disease, we've worked with them in order to on the R&D and on solutions and all kinds of things, scientific research, partnerships, and all kinds of things. Regarding aid, Israel has also, it took a little time until Israel stopped procurement and started producing. We moved from procurement to self-producing, and within 2 or 3 weeks, we had excess PPEs for the Israeli market, the Israeli need, and we started giving to others. So we gave out PPEs and all kinds of assistance to different countries like Rwanda in Africa, Guatemala in South America, in Latin America, to Uzbekistan in Central Asia, all kinds of different African states and Asian states. We gave out assistance. Besides that, we also have Israeli organizations, which I'm so proud of, NGOs and others that work, like even here in Los Angeles, we have an organization called Israel, and I went to volunteer there yesterday. I went to see their activity, and I was so impressed that I joined the crowd and I started volunteering. They pack food packages, and deliver food packages, thousands of food packages to needy citizens in the Los Angeles area. So we have quite a few Israeli organizations that are on the giving side, on the donation side. I'd also like to mention Teva. For instance, the Israeli Teva medical company gave 6 million pills to the American market, and we were also dealing with that. There are also mutual donations from California to Israel, from Israel to California. So this is also a big issue that we deal with, but medication is number one, whether it's pills, actual pills, physical pills, or whether it's PPEs, Israel is involved in global aid.
Thank you. In March, Vice President Pence and Israeli Prime Minister Benjamin Netanyahu agreed in a phone call to advance technological and scientific cooperation, and there's now a bipartisan push in the US Senate to do just that. Can you talk about the process for enhanced US-Israel cooperation around technology?
Yes, there are many such initiatives. And we know also that there's legislation going forward in the Congress in order to support such scientific cooperation. It's not only statements by Pence and Netanyahu, which came out at the beginning of, more or less relatively at the beginning of the pandemic, but it's also legislation that's going to Congress, which is going to promote a scientific cooperation between Israel and the United States. There are many such initiatives. Some of them are G2G, government and government. Some of them are B2B. Sometimes it's also R&D centers work with other R&D centers. Like, for instance, the Weizmann Institute in Rehovot in Israel works with their counterparts in academic and research field all over. Or for instance, the Rambam Hospital, which is a medical center, works with. So I don't want to get into all the details; it'll be quite boring. I just want to say that there are a lot of initiatives going forward, just like the Iron Dome. We all know the Iron Dome, which was the first operative system which enabled defense against ballistic missiles, produced together by the United States and by Israel. And it's now the one and only really operative system that can cover all ranges of missiles and rockets to protect. And we can protect the United States as well against enemies. So this was a result of co-production, of working together. And we're lucky that we have such a wonderful alliance with the United States. I think that Israel has no better friend and no better ally than the United States. And I think that the United States knows that they have no better friend than Israel. So this alliance is very important, and a lot of initiatives. Some of them are also between the R&D centers, so I don't want to go into the actual details of them. But in all the fields that I mentioned before, whether it be security, tracing, telemedicine, remote censoring items, and all these things, there is cooperation going on between US and Israel and other global players.
Thank you. What are Israeli healthcare NGOs, such as Save a Child's Heart, doing in the midst of the COVID-19 pandemic?
You're talking about NGOs, or you're talking about governmental healthcare systems?
They said Save a Child's Heart, so I'm not sure if that's an NGO or...
Okay. What I would say is that, first of all, let me talk about the policy of the State of Israel, which also leads on to NGOs and how they fit in. First thing I would say is that Israel has developed the largest economic assistance package since its existence. It's the first time that they've developed an economic recovery plan to the amount of 18 million shekels, which is $22 billion. I know that's small in comparison to the United States. Our capabilities are not the same as the United States, but for the Israeli market, it's the largest assistance plan that was set out in history. What I think is important about it is that there are 4 blocks to this plan. The first block is the health and civil provisions, and that means acquiring PPEs, acquiring respiratory machines, ventilators, all these things, taking care of the basic needs of the civic population and supplying them to hospitals. The second block of the aid is social security net, what we call a social security net, and that's taking care of the workers, taking care of that they have paid leave, that those that are unemployed get unemployed pay. All these things were extended. All these things, grants were given to those who are unemployed. There was extended unemployment pay for those who are unemployed. Also, the government made decisions on extending a leave of absence from work while being paid. So all these things were addressed in the social security net. The third aspect is the business continuity. The business continuity is all the aspects of solving the problems of rent and utilities for small and medium businesses mainly that need to continue to survive, and they don't have the ability to survive on their own. The fourth and last aspect of the package of the Israeli assistance package is what we call economic acceleration, and that's the idea of R&D, promoting new fields, the innovation, the fields that will be the fields of the future, digitalization, training the people who are unemployed to move to shift over to the trades of the future, as one would say, postponing government fees and debts that one may have towards the government, like taxes. All these aspects were taken care of in the fourth bulk of the assistance. Now, NGOs fit in different categories here. Like, for instance, PPEs. So you've got a lot of what we call civil needs. So a lot of NGOs in Israel that have entered that niche. I'll just mention one example. One of the leaders of Checkpoint, which is a very successful high-tech company in Israel in the cybersecurity field, the founder, decided to move forward and established an incubator with 30 scientists. He brought them all together, computer tech guys, together with medical profession, and he just created it out of nothing. And he said, work on ventilators, work on masks, work on whatever. So you have a high-tech guy coming in as a private person, setting up a whole lab and bringing in the people from multidisciplinary teams together in order to come out with solutions. And they came out with solutions of the ventilators and 3D PPEs and all kinds of things. So the NGOs have a large part to play, also private players who can come in and give their part. If you look at, for instance, the social security net, there are many NGOs in Israel in the social impact field, who are giving out food or distributing food, maintaining contact with elderly people, like, for instance, those who are 67 and above, regarded as a high-risk factor. So we have a whole mechanism of volunteers. They call each one up. They even come to speak to them across the door. We had even the IDF involved in visiting and giving out food. So the NGOs are involved, private people are involved, and the government are involved. All together in this coordination is by the Central Command Center, which was set up under our secret services. So everything is coordinated in order to try and bring as much as possible to the individual at the end point, to bring him what he needs.
Thank you so much. And this will be our final question. What is the Israeli Consulate in Los Angeles doing to support its compatriots and contribute to local authorities? In what way has your work changed due to the new reality we face?
Thank you. Well, you know, we thought with the canceling of meetings and the canceling of receptions, which is, I mean, it's part of the work of a diplomat, a bulk of the work of the diplomat, we thought we'd sit idly by and have some time. Of course, that never happened. We didn't have a minute for ourselves. I know that some people are bored at home and they're looking for something to do. Well, I didn't have that privilege of having time. We've been very busy. Our agenda has just been filled with the things that have to be taken care of due to the coronavirus. So I'll give a few examples. For instance, first of all, rescuing teams, rescuing Israelis. We had all kinds of Israelis who found themselves stranded. You know, Israelis are a special category on their own, and they travel, they trek to all kinds of remote places. And then we have to go out and save them. So our diplomats were part of the structure force of helping, assisting in the face of this pandemic. And part of our task was also going out in order to rescue these Israelis who found themselves stranded. I'll give an example. We had a boat that came into San Diego, which had coronavirus victims on it, and we had Israelis who were not sick on the boat, and we had to get them out of there. We had a few problems. One is they didn't have a visa for the United States, because the boat was not supposed to come to the United States. Second thing was we needed to get air flights for them, and all air flights were canceled. So all kinds of things that had to be taken care of. We took care of them, and they got out of the boat, and they got back to Israel. So our big issue was taking care of Israelis who were stranded. Second issue was, for instance, transferring bodies. Just like we have to take care of the living, we have to take care of the dead. And we had a lot of requests of people, and this is a time issue. You can't postpone it. So we had people, their dear ones passed away. They had left in their will that they want to be buried in Israel. We had to take care of this. With all the restrictions and all the issues that are going on, we took care of it. A large part of our work recently has been making contact with California companies, or companies in our region. We're responsible for 6 states here in Los Angeles. And we connected between companies. At the beginning, Israel was purchasing PPEs, so we connected between the requirements of the state of Israel and the companies here in California. At the moment, we're not procuring and we're not purchasing anymore because we've reached a situation that we can self-produce. But that was the urgent item on our agenda. Jewish community and other communities, we're in contact with the communities. We maintain contact with leaders of communities to find out how they're doing. You know, there's also this fear of anti-Semitism that can rise because of conspiracy theories. We're not in a clean world, as one would say, and there are all kinds of conspiracy theories that are voiced, and sometimes it's attacking the Jews. So we also are in contact with Jewish communities. There's a community that was vandalized even during the pandemic here in Los Angeles. So we're also in contact with the Jewish community and also other communities, just different denominations of Christianity and Muslim. I would say another aspect of our work has been digitalization, transferring all our activity to the digital sphere. So we did webinars and we did seminars and we did cultural events and all kinds of things. That was also part of our emergency getting together. In general, the consulate is open. Although most places of work are closed, we're regarded as an essential place of work. And if you heard my description, and I think you'll agree that we were essential, and we were taking care of all these needs throughout this period of time.
Thank you so much, Consul General Newman. Stephen, I'll turn it back over to you.
Great. Well, I want to thank Dr. Newman again for taking time out of your busy schedule with all the great work you're doing to share some thoughts. And I know it's not easy to answer questions from an international perspective down to the nitty-gritty of actually operation in the local level. But from what you described, the consulate here is actually doing quite a lot. So I want to thank you for your support. And at the same time, on the more personal level, as an Asian American, we do see some incidents of racism that's been happening. So to hear this is also happening to the Jewish community is devastating. And I'm hoping that the audience here that are listening will continue to spread the word of the importance of international collaboration and not only tolerance, but also working very closely with our partners from around the world, regardless of their background. And we wish you, for the sake of all of us, when it comes to developing the vaccine, antibodies, and the therapeutics in Israel, to speedily be available to all of us, because I think this is going to be the future. Without those treatment plans and without the vaccines and antibodies, it's going to be very hard for us to return to work and make sure that our economies are growing. But with that said, I want to thank you again for taking time to share with us these great thoughts. And I also want to thank Kim from the World Affairs Council, as well as Jessica, for your great work in putting together these very important conversations so that the LA community and folks from around the world who are joining us understand the importance of these partnerships before COVID-19, during COVID-19, but especially now. It's more important than ever for us to work closely together for a brighter future for all of us. So thank you. I'm going to turn this back to Kim.
Hi, Stephen. Thank you, Dr. Newman. And Stephen, who knew when we were putting our partnership together that all of this would transpire? It's a wonderful partnership. Dr. Newman, we really appreciate all your insightful input on what's going on in Israel. You've given us a lot to think about. We have a wonderful lineup of programs for you all next week. On Monday, we discuss the potential end of the lockdown. And that's with LA County Supervisor Catherine Barger and Dr. Barbara Farrar, Director of the LA County Department of Public Health. Then on May 20th, Hong Kong on the Brink with Jeffrey Wasserstrom, UC Irvine and leading China specialist, Elaine Yu, journalist at the New York Times based in Hong Kong, and Sewell Chan, who is editor of the editorial pages of the Los Angeles Times. And of course, on Thursday, Politics in the Time of Coronavirus with Dan Schnurr. For a whole list of all of our upcoming programs, we've provided that for you on your control panel. Just click on the word that says handouts. Please register today. Everybody stay safe, stay informed, and we hope to see you soon. Thank you. Take care.